right. Thank you very much, Rob. Thank you for being here. And for those of you who were previously at Philip Hammack's presentation, this will be kind of a spin-off, sort of like Grey's Anatomy in private practice. So you'll notice that I'm using more or less the same language that he used, and he used kind of a language that we're not used to listening every day in our lives, and in our practice and in our community.
Constantinos, can you speak into the microphone?
Sure. Closer? Yeah. Better? Okay. So before I started conducting this research, which is what I'm presenting is part of a pilot study. It started a year ago, but it evolved into my thesis, my master's thesis in counseling psychology. I was reflecting on, okay, what's at stake for me? How do I position myself when it comes to this research? And what really stood out for me through the literature I immersed myself into is how do I manage to honor my participants' voices? So I guess it all starts with reflecting on my own HIV subjectivity as a gay man, challenging the HIV/AIDS phobic discourse. And it all started back in 2005, probably 2006, when I came out the first time as a gay man to my parents, especially to my mom. And if you haven't met a Greek mother, there's a lot of drama when it comes to those issues. So yeah, kind of my coming out story became a soap opera for the family. And she was convinced, based on her idea of what being gay means, what HIV is. She was convinced that I would never see my dreams materialize. She projected the belief that, okay, you're gay, you're gonna contract HIV, and eventually you're gonna die, and I'm gonna lose you. She hasn't accepted it so far. We're not talking about it, but I can understand her point of view. I can understand that she's internalized, and we talk about this internalization of those discourses that are out there, and we'll talk about more about what discourse means. So she internalized this discourse of gay identity as something that's pathologized. So I had to challenge that. I haven't figured out still the way how to get over this obstacle, but but that made me, when she told me that, I'm afraid I'm gonna lose you, you're gonna die of age, that made me think about, okay, so I'm a gay man, how do I see my future? So I guess she transferred that HIV and AIDS phobic discourse to me. So I started thinking, okay, how am I going to navigate my role in a gay relationship? What if she's right? And prior to that, I had never thought about HIV and AIDS. I wasn't exposed to the gay community, despite growing up near Athens. So I started looking and reading online, etc. And then I went to university to study, which was far from home. So I had this opportunity of developing my own my own identity as a gay man. So what I heard from my family and people I knew in my life, and what I was reading online from studies that were conducted in North America, or gay blogs, there were like two different or multiple contrasting stories. There wasn't one story out there talking about HIV, as the gay man's disease, or AIDS as a gay man's disease. So I became really interested in the topic of serodiscordance, because the way I felt about it, without being exposed to all of this, was, okay, yes, I would date someone who's HIV positive, but it was more of a hunch. I didn't know why I felt that way. So I started looking, and then doing assignments for my courses on serodiscordance. And what stood out was, the finding that men who had sex with men represented the risk group most frequently diagnosed with HIV, and that's from Canada, United States, and Australia, and many other countries. But as an HIV-negative gay man, I didn't find a lot when it comes to HIV negativity, the HIV negative subjectivity in serodiscordant relationships. So as person, she's a social anthropologist in Australia, and she's done amazing work with HIV discordant heterosexual couples. So she noted that, HIV has been in the forefront of scientific research for 3 decades now. However, little or no emphasis has been placed on the HIV negative partners of seropositive individuals. Although there's a lot about HIV positive individuals, there's a lot about men who have sex with men, primarily. And then there's some literature on the diet, the serodiscordant couple. So my questions were, okay, so how do HIV-negative gay men construct their seronegative identity when they talk about their seropositive partner? How do I construct my HIV subjectivity when I, for example, if I were in a serodiscordant relationship, how would I construct that? And what functions do seronegative partners' discourses serve regarding their personal positioning in a serodiscordant relationship? And I think it's a little bit complex and not so easy to digest, this kind of vocabulary, this kind of language. But function has to do with, okay, so why are we phrasing, when we're talking about something, why are we phrasing in a certain way and not in a different way? Like, what does that have? What is there in it? What is in it for us? What does help that? What does that help us do? So the background, and as I said, this evolved into my thesis. So I did a literature review, and the major trend in HIV research emphasis is placed on issues such as the emotional stresses and challenges of serodiscordant partners, or the sexual risk and HIV transmission among mixed status couples. So I'm citing, as examples, 3 different published studies that I came across. So for example, the first one from Eden and colleagues, 2009, they looked at the relationship between partners' serosorting beliefs, sexual communication beliefs, and perceptions of risk in seroconcordant and serodiscordant gay couples. So I think someone touched on that earlier about serosorting, and it has to do with sexual partners choosing their partner based on their sero status, their HIV status. So HIV-negative people choosing partners who are HIV negative, HIV positive choosing partners who are HIV positive, or they choose to form a serodiscordant couple. And then, so in that study, the researchers recruited participants, gay men, who met the criteria that they had set. And what they did is they gave them questionnaires and scales. So, for example, to describe the serosorting or the sexual communication beliefs, one item would be, if my partner tells me his HIV status is the same as mine, I'm likely to have unprotected sex. And then there was a Likert scale from 1 to 6, strongly agree to strongly disagree, etc., etc. So they looked at sexual beliefs, sex partners, perception of HIV risk. On the second study, it was a similar philosophy. We gather our participants, gay men who are in serodiscordant relationships, and we give them some questionnaires to fill out, and they looked at levels of psychological distress at the diet level among HIV-discordant male couples. So, for example, they gave them the brief symptom inventory, or the Beck hopelessness scale, the Beck depression scale, the relationship belief inventory. So both partners fill out the questionnaires, and then they run their statistical analysis, and they came up with the results. And the third study, something similar to that, the relationship between personal versus relationship factors and safer sexual behaviors. So, for example, they measured sexual satisfaction of each partner with items such as how satisfied are you with the amount of physical attention expressed in your relationship, from 1 to 6, strongly agree or very satisfied to very dissatisfied. What I see as a caveat in this approach, which is more quantitative, is I don't think you can or you are allowed to reduce human experience, which is way more complex, into the level of a number. So sexual satisfaction cannot be described, on a scale from 1 to 6. It's much more complex than that. And that's when I came across more alternative approaches, which I'm gonna go into in a bit. But basically, a person said that HIV, through that kind of literature, is conceptualized as intricately related to the notion of risk negotiation as its defining characteristic, uniformed in terms of the seronegative partner's lived experience. So we take all the HIV-negative partners and we throw them all in a pod, and we get some numbers without, for example, reflecting on or looking at, okay, so how long have those serodiscordant couples been together, or those partners? Has an HIV-negative partner who's talking about his HIV-positive partner, like now in the present, lost another partner previously due to age? How is is the language he's using different from someone who's in his first gay serodiscordant relationship? And the third one, representing one pole of the binary seronegativity, seropositivity, denoting mutual exclusivity and conflict between the two statuses. So we place seropositivity in one end and seronegativity on the other, and there's, as Trina mentioned, there's this in-between. And what I disagree with is this idea of the researcher coming from outside the community and defining such terms for the community. I think this is something that we as gay men have to do. We need to define, those terms and what they mean to us. So I'm talking about alternative approaches. I'm not sure if that's the correct term, but I see it as an alternative approach. They're more qualitative approaches, and they're approaches that give the opportunity to research participants, to talk about their lives, to talk about their stories. So, according to Person again, the notion of serodiscordance embraces a range of meanings and practices. So, for example, she did in one study that she published in 2011, she talked about how is HIV negativity done, how is it enacted, how is it brought into being by negative partners. And she's an anthropologist, so that's the kind of language they use in the discipline. So. Okay, yeah. So for example, in the quantitative literature, the ways in which HIV negativity is done, enacted, or brought into being, and accordingly, HIV positivity. It's an image of serodiscordant relationships as burdensome, emphasizing the variety of social, sexual, and emotional challenges. In the second study, for example, serodiscordance as context-specific construction. So those researchers went and examined in depth, how do serodiscordant couples talk about their relationship? And they found that it's very context-specific. So couples, when they were alone, they described their relationship as conflictual, among other things, right? But the difference was when they were in social, familial circles, they described the relationship as, as one. We're an HIV couple. We're a mixed status couple. Whereas, they didn't do that when they were alone. They described themselves as different. In the third one, Beckerman, Litani, and Lorb, they talked about this story of tension and complementarity. So, okay, being in a zero-discordant relationship, yes, there is some tension, but there's also, this idea of complementing each other, We both have strengths and weaknesses. The relationship have strengths and weaknesses. We recognize that, and we're working together. And that's what a person said also. She said, I don't disagree with the quantitative approach to examining zero-discordance that says, there's a lot of tension, there are challenges. Yes, there are challenges, but there is more than that. Then person in 2008 again, she talked about zero sharing and zero silence. So zero sharing had to do with talking about the issues that come up in the zero-discordant relationship, whereas zero silence was about silencing the HIV subjectivity or the zero-discordant identity as a whole. And what she found was, for example, they silenced not because they separated themselves, the HIV-negative partners, but because they wanted to protect their HIV-positive partners. And the last one, HIV-negativity as a normalizing agent. These people, they worked with heterosexual zero-discordant couples, and they found, for example, that men who were HIV-positive in a relationship with an HIV-negative woman, they felt normal being with someone who was HIV-negative. So there's the issue of HIV normativity coming here, and what does that mean for us? So methodology using naturalistic data. Both quantitative and qualitative approaches, they have strengths and limitations, but an additional limitation is, how does a researcher that comes in and interviews people, whether it's, if it's qualitative or handing in a questionnaire, if it's quantitative, you somehow impose an agenda. So there are other pieces of research out there that says, okay, maybe we need to use more naturalistic data and examine interactions in the context that they appear. So what people actually do without such interactions being contaminated by the perceived or actual presence of the researcher. So I thought that, maybe online forums is a good way to start. So, and what Goodman says that online forums and support groups provide outstanding opportunities for researchers to investigate how personal narratives engage in a dialogic relationship with multiple socially constructed concepts in order to generate renditions of individual subjectivities, which is not easy to conceptualize, to understand, but basically he says, well, it's a good way of doing research. For my research, I went online. I found this service. It's called the Bodycom. It's a US-based service dedicated to the improvement of the quality of life for individuals living with HIV and AIDS. So it provides online access to clinical knowledge, sense of community through connection, a clear understanding of the discourses around HIV/AIDS and its treatment. I collected 22 online postings uploaded by individuals who were identified themselves as gay, male, seronegative, and in a relationship with a seropositive partner. This is, I'm not going to go into detail, but this is an example of the posting. So they were pretty short. My theoretical framework is social construction. So I look at, how a phenomenon is constructed through interaction, and how do we use language as our means to construct our versions of reality. And discourse is a core concept, is an idea or a way of talking that influences and is influenced by ideas. So language is situational, action-oriented. There's an action orientation, and there's the constructed versus constructive nature. So I looked at meaning, purpose, function, and accountability position. In terms of my findings, the meaning, what do participants imply or explicitly reveal about the relationship? So I found love, acceptance, support, and commitment. I found uncertainty about the future. And these are like excerpts from the postings. So for example, the first one, I accepted the fact that making this relationship work might not be easy. I really love him and I could see staying with him. I wasn't about to turn my back on someone I loved so much. I found a discourse in terms of the medical discourse, I would say health-related concerns, a discourse around intimacy and sexual satisfaction. In terms of the function, what do participants want to achieve through the language they employ? They need to convince their partner to become more invested in the relationship and acknowledge their feelings. They need to learn how to navigate their role in the relationship. Sorry, I'm going fast because I've run out of time. In the positioning, what identities are being constructed through participants' ways of talking? So blaming the partner, the self, or the disease. Ownership of feelings and assumption of responsibility for the relationship. Spoiler alert, when it comes to my thesis, because discourse analysis has a lot to do with going in depth and dissecting paragraphs, sentences, words, everything. So what came up through the discourses those individuals used was an alliance, a discourse of alliance, and a discourse of dissonance versus or ambivalence. Concluding thoughts, implications for counseling practice, or impact on health institutions. For me, it's really important as a psychologist, as a future psychologist, to notice how individuals talk about things. How do they talk about their identity? So when a zero-discordant couple comes to counseling, I want to see, I want to be able to discern those discourses of alliance and strengthen them through my intervention, and those discourses of ambivalence or dissonance, and also, intervene accordingly. In terms of the health institutions, when it comes to HIV prevention campaigns, what's the language we're using? What's the message we're trying to convey? What's the image we want to portray as gay men, as an LGBT community when it comes to HIV and zero discordance?